The holidays, of course, are here, and while many of us are filled with joy this time of year, there are a lot of people out there, probably some of you watching right now, that really struggle for one reason or another. Dr. Azfar Malik is the Chief Medical Officer for CenterPointe Hospital. Dr. Malik, nice to have you here.
Thank you.
So let's talk a little bit about this concept of the winter blues and seasonal affective disorder. Are those interchangeable terms, or are those two different things on the same spectrum here?
Well, winter blues is a catch-all term, let's put it this way. Winter blues would be anybody who's feeling down, sad, or, if you look at evolutionary, we have been, if you look at animals during winter, they hibernate. So a lot of symptoms of hibernation may be what we experience, what we call winter blues. People are avoiding to going out or not socializing, eating more, sleeping more, things like those. Those could be considered somewhat of winter blue areas of subsyndromic symptoms. But if these symptoms get worse, you may call them what we call seasonal affective disorder. Actually, seasonal affective disorder is an older terminology now. Now we tend to call what we call depression, which is seasonal.
Depression, which is seasonal.
Right.
And I assume the symptoms mimic depression in general.
Absolutely.
Is that right?
Symptoms mimic depression. For example, a lot of these depression, if they do occur during winter, and people tend to get better during the spring season, and if you're feeling overly good, you might be part of the bipolar depression versus a major depressive disorder. So there are two kinds of depressions, and I would say it's a half and half split. A lot of people who suffer from seasonal, what we call seasonal depression, some of them could have bipolar depression, and that's when you need to be looked at and evaluated further. But about 1.4% of people have the seasonal depression in Florida, versus 9.9 may have it in Alaska, right? But Finland is very high, about 9-10%, but Greenland is low. So I don't know. I mean, we yet do not understand it very well.
We've heard anecdotally that it has something to do with the loss of daylight. Maybe that's a factor, maybe not. But at the end of the day, how do you, if someone comes in and presents with these symptoms, how are you able to treat them? How can you make them better?
Well, treatment, there are a lot of theories behind that, right? So some of these would respond to light treatment. Some of we think the etiology has to do with melatonin, some serotonin being low, antidepressants work in these cases. So it depends what the severity of the symptoms are. If the symptoms are mild, I would say doing something like light therapy would be enough. But if the symptoms are severe, making you dysfunctional, then maybe more aggressive treatment, like maybe using an antidepressant could be. Therapy could be a possibility and things like those. It's
great information, Doctor. Thank you so much. For more information, you can call the number that we are about to put on your screen. It is toll-free, 1-800-345-5407. And can you stick around for a little bit?
Sure, I can.
Excellent. Stick around after Great Day, my friends, because we are going to continue this conversation with Dr. Malik on Great Day Extra Live. That would be on Great Day St. Louis's Facebook page. We'll try to get that going at about 10:15 this morning. And we want you to tune in and share it with everybody so that you can ask us questions while we've got the doctor right at our side here.